good afternoon, everyone, and welcome to People and Planet United, a global health and purpose summit. My name is Brianne Chai-Onn, and I serve as Head of Sustainability within the Global Purpose and Social Impact Practice at Fin Partners. And I'm delighted to be joining you today for this really important conversation at the intersection of health, sustainability, and innovation. And this summit really brings together leaders from across sectors to explore how we can better, drive outcomes for both people and planet. And I'm very pleased to be part of this discussion. Today, we are going to be discussing the New York Blueprint, Scaling Healthcare Decarbonization for Global Impact. And we'll be exploring how local efforts can serve as a model for broader change and how healthcare systems can take meaningful steps towards a more sustainable future. And so it's my pleasure to introduce our speaker this afternoon, Aharon Kestenbaum, Director of Energy and Sustainability at Montefiore Health System. Aharon leads initiatives focused on healthcare decarbonization, working to reduce environmental impact while maintaining high standards of patient care across one of New York's leading healthcare systems. His work highlights how operational and infrastructure decisions can play a critical role in shaping more sustainable health systems. So Aharon, thank you so much for joining us today, and I will turn it over to you for your presentation.
Thank you, Brianne. Thanks for the introduction. It's great to be here at the Global Health and Purpose Summit. I think it's very important that we're having these conversations. I think it's important for all professionals in this space to be aware of what's going on in New York City specifically, but I think very importantly, and what I'm going to try to illustrate in this discussion, in this presentation, and hopefully in the Q&A after, is how this is really applicable to all geographies. While New York is a very good blueprint for other places dealing with local law or regional laws that are mandating carbon reductions in buildings. So starting here with my first slide, first I want to speak to that. I'm going to be mentioning a lot of incentives and disincentives that are related to finances. But first and foremost, we have a real interest in doing this work with all that aside. Healthcare accounts for a large amount of global emissions. Here you could see it's 4.4%. It's actually double that in the United States. And in inner cities, it's even more so. And for us, particularly at Montefiore Einstein, the Bronx, which is the community that we serve, experiences the highest rates of asthma hospitalization in New York State, in the entire state. So we are treating the victims of climate change, of pollution. So it's actually in our it's our responsibility, yes, and it's in our business interest to reduce any of our contributions to this problem. And so I just wanted to lay that out in the beginning, because I'm going to be talking a lot about different types of infrastructure projects, about the local laws, the penalties that are associated with that, the entire regulatory world that we're about to dive into. But before all that comes our institutional commitment to our communities. So with that, I'll get into Local Law 97. So following a New York law called the CLCPA, which is a plan for decarbonization for the entire state, New York City implemented in 2019 Local Law 97, among many other energy codes and laws that have been passed since then. Local Law 97 specifically addresses emissions, CO2 emissions, that is, from the built environment. And so what this law does is very simple. Based on your building type, you have a per square foot allowance of carbon emissions, which is measured in pounds in pounds of metric tons actually of CO2, and any amount of carbon that you are above that threshold is multiplied by $268, and that really gives you what your penalty is, if any. If you're less, if you're emitting less than that, then obviously you have no penalty, and there is the disincentive of a penalty providing the incentive to reduce building emissions. So for us, that's a large annual liability. It's a real recurring liability of millions of dollars in penalties that started in 2024. Right now, based on publicly available data, and this law applies to any building over 25,000 feet, less than 10% of covered buildings are actually exceeding their caps. The limits, however, in the first period are a lot less stringent, let's say, uh, and with the goal being zero carbon by 2050, as you can see here from this illustrative graph on the right, the penalties are represented by that staircase going down are become increase the allowable emissions reduce substantially at the end of every 5-year period. So right now, let's say you're above the allowable emissions, doing nothing, represented by the blue line of emissions staying the same. Eventually that blue line will come above that allowable emissions limit. And so this represents, a liability, an exposure to local law penalties, and they really do become substantial, especially as you work your way out to the third and fourth, to 2030, 2035, certainly 2040 and 2050. Very, very big dollars that we're talking about, and so there's a huge incentive, to avoid those penalties. Now, what we try to do here at Montefiore certainly is to capture this moment, this opportunity, and turn that into a value creating engine, to something that can help the organization not only become more efficient with our utility consumption, which is a very, very substantial part, but at the same time help avoid those penalties and modernize on our infrastructure. A lot of these times, these projects are very hard to complete without additional disincentives on the one hand, or incentives, which we'll discuss in a moment. And so lots of very exciting infrastructure projects are coming up as a result of these disincentives. And the incentives, on the other hand, which I'll discuss on the next slide, really help to push those projects over the finish line. So moving on to the next slide, I do want to talk about this financial shift that we're discussing, moving from just a pure liability, right, um, to to a real opportunity. Now, a project, let's say, like you want to build heat pump projects, which is, in simple terms, a technological approach that captures process heat. So let's say you're cooling water for cooling a building, you can actually capture the heat that's generated from that process and transfer it over to another use, like heating water for hot water needs, right? So a project like that, or very, very large lighting projects, even, you know, they may have very good returns on investment to begin with, but a lot of things have good returns on investment, and you need to weigh all those different opportunities. And so, what the market has come up with, since there's these very large commitments, representing a lot of liabilities in terms of local law 97 penalties, the market and government, I should say, has started to develop incentive programs, lots of different incentive programs. So this again is just illustrative on this slide. We're looking at, say, a $10 million project. Let's call it a heat pump project, right? We have stacks. We're able to stack these incentives on a particular project. So NYSERDA, the New York State Energy Research Development Authority, they are providing huge incentives for projects like heat pumps, electrification, major infrastructure projects. Last year, they had $30 million of funding, with a cap of 5 million per organization. This year, they renewed it for an additional 20 million. So a total of 50 million over 2 years is very, very substantial, specifically earmarked for hospitals, I should mention. And so we capture on that opportunity. Then you have something really interesting that started to happen in the last few years, which is insurance funds have recognized the risks posed by climate change to their employees, and so to the employees that are covered, sorry, under the policies that are managed by these insurance companies. And so what they've started to do, and the New York State Insurance Fund, as you can see, NYSIF over here, have started to create programs where, by measuring our emissions, by developing plans for reducing those emissions, and third, by reporting annually on our progress, how much our emissions are this year and what projects have we implemented to reduce those emissions, they are offering up to a 5% of your insurance premium as a rebate, right? So an actual reduction in your insurance costs by 5%, which is unheard of. But now it's heard of, and it's starting to really proliferate throughout the industry. And finally, you have the utilities, right? Con Edison offers amazing incentives through its commercial and industrial program, and we work with Con Edison on capturing these incentives regularly for large projects like electrification of chillers, boilers, high efficiency boilers, conversion to heat pump based systems, where we're really recycling heat into new processes. All of these incentives are not mutually exclusive. They are stackable and they support one another. And so if you take a project, let's say like a major heat pump investment, that alone would be $10 million without any of this in place, all you would have is what's on the right here, which is avoided penalties and the return on investment, which may be 10, 15, 20 years, depending on the age of your existing infrastructure, what you're doing now, the scale, a lot of different factors. But once you stack these incentives, $5 million, $2 million, another $1 million, you are really looking at a much more attractive proposition to leadership. So this is a real, and these types of incentives exist in lots of other geographies, not just New York City and New York State, although I would say they're probably leading the charge in terms of the United States. But these incentives exist elsewhere. And so this is a real important aspect of energy and sustainability management in this day and age, particularly in New York City. So what are we talking about when we're talking about the threat? What I mentioned at the top in terms of the actual impact on the communities that we serve, right? So the image on the right is also illustrative, but it's a picture of the Bronx, and it shows hot and cold zones. The heat is supposed to represent areas with higher pollution, right? And the blue areas with low pollution. The truth is, as I said, the Bronx would be essentially all red if you zoomed out and looked at all of New York City. We have real big problems with heat waves. We also have problems with air pollution. We have problems with flooding. And so what's called the heat wave vulnerability score, which heat waves are a big cause of a lot of the reason why people end up coming to the hospital for any one of these climate related symptoms, rose dramatically just in the past 5 years, and that would be expected with with the development that you see in New York, as well as with global trends of temperature. So how do we respond to this? Well, through that mechanism, those of incentives and disincentives that I described. We've created lots of different project opportunities, which are not only improving our performance again, but they're actually reducing the negative externalities of our operations. Like I said in the very first slide, very much in our interest to not harm the communities that we serve, right? So this includes a 5 megawatt cogeneration facility, and this already, certainly precedes me. This happened in the 90s. Montefiore was a pioneer in this space, and now we're continuing that tradition with these heat pump projects that we are doing at 3 of our sites. Free cooling that's utilizing from the outdoors. When it's cold enough outside, you still have cooling needs inside the building, rather than running an engine, burning fuel to create that. We use the cooling from outside, but that takes investment actually in programming our building management systems, replacing RTUs. The nuts and bolts of of energy efficiency management. So insulation, windows, lighting, all of these projects, while sometimes individually on a small scale, not impactful, when you do them at scale with these kind of incentives and disincentives at play, and I really mention, and I'll get into it a little bit later, strong governance in your organization that understands your mission, your goals of zero carbon by 2050, 50% by 2030. you're able to do a lot of these projects at scale with wonderful returns on investment and returns of better environmental quality for the communities that you serve. And that's ultimately the impact that we're looking to have as a healthcare organization. In total, I'm really proud to say that our sustainability program, through the leadership, the governance that we've developed, and the real commitment to doing large energy infrastructure projects that will reduce our emissions, our operating costs, have yielded just tremendous returns to us as an organization. Since 2007, we've reduced our carbon emissions intensity by 31%, which is pretty amazing given our development. Generated almost $40 million in revenue from these projects. We've avoided, just to date, just over the past few years, through compliance strategy, $172 million of liabilities in Local Law 97 penalties over the entire period, all the way out to 2050. And just in the short term, we're talking about $20.1 million in the first 5 to 10 years. So the impact is important to state the economic impact, because wherever you are in this industry, you're always going to have to answer those questions, right? Again, that's not the primary reason why we're doing it, but we have to remain financially valuable as an organization to be able to continue to support our communities. So this is the process that I built out that I want to illustrate in today's discussion. If you're building a program from scratch, you want to arrive at a point where really you're maximizing the benefit from a sustainability program, and not just on the building, on the building system side of energy efficiency infrastructure investments that I've been discussing. You also want to ultimately get to every place of efficiency that you can get to here on number 4 on the right. But before you do that, you have to go through a process. First of all, as the old saying goes, you can't manage what you can't measure. You certainly cannot fund what you cannot measure. So the first thing you have to do is build a greenhouse gas inventory. And with that, you have a baseline of what your penalties are going to be, or your potential future exposure to penalties are going to be. And you can demonstrate the positive impact on the community that reduction in greenhouse gas emissions will generate. Number 2, you have to know your building. You have to perform energy audits. You have to understand your buildings. You have to get the right groups to and professionals to look at your buildings from every angle, every little angle, understand every building system, the different components at play in terms of what's driving the most costs, what's creating the most emissions, and from that, which systems have the greatest opportunity in terms of investment and reduction in emissions, reduction in costs. Those are 2 absolute musts before you get to starting proposing to proposing projects. And with proposing projects, what you really got to do is stack all of these economics that we talked about in the earlier slide, including the penalty avoidance, including the incentives from the utilities, the incentives from the insurance fund, and of course the avoidance of the disincentive, right? And the ROI itself that you're going to get, the energy savings that you're going to get. You've got to stack all those together, and then you go and execute. Now, finally, I want to speak about in healthcare, we have a lot of specialty areas of decarbonization, resource efficiency that we engage in, and I'll talk about them more deeply in the next slide. But really, we're trying to engage every part of our organization, doctors, nurses, operational staff, to really find every area. And sometimes we don't come up with it. A lot of times, the clinicians themselves come up with it, and really make sustainability part of the fabric of our organization. Really have mission alignment across the board, and implement some really cool projects. And I'll discuss some of them right now. So, for example, desflurane is a very high global warming potential anesthetic gas. That means a pound actually of desflurane is equivalent in terms of its ability to trap heat in the atmosphere is 2,500 times stronger per pound. So we've worked over the years, but with the leadership of our anesthesia department to reduce that substantially. It's actually more than 93% reduction. At this point, we're up to about 99 and really only saving it for fringe cases to test out where it actually might be the most beneficial in terms of treatment, right? Of patient care. So that's a reduction, direct reduction in our scope one. That's direct emissions from your building's emissions. Next is a whole slate of waste conservation. So medical device reprocessing is a huge one. We work with partners. We have specialty bins all throughout the hospital for placing instruments into medical devices into, which are then sent out to a factory and brought back up to the standards of the Joint Commission of the Department of Health, and we get paid for it too. And we could ultimately purchase those back if we choose at a discount. Uh, we had a bunch of doctors who realized that requisitions were being printed automatically all of the time, and in some cases they found we could just have it be an opt-in situation where if the patient wants it, then they're offered the opportunity and then it's printed out. And also we found ways to cut off a page or two off of requisitions with just wasted paper. As a result of just the simple project that was brought up by a couple of doctors, we now have a green team of something like 20 different clinicians, and we've expanded this across many, many different offices, and now we're working it into the faculty practice groups as well. Currently, we're saving about $2.5 million pages, sorry, across the system annually. And of course, we have e-waste, lots of other really cool projects in radiology, like reducing waste from contrast bottles by ordering bulk instead of single bottles, where when we have a large enough case uh, 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 within a given clinic. And so really lots of very cool things that only comes about from engaging, again, as I said in the end of the last slide, engaging the frontline staff and figuring out what they know best, which is where is the waste, right? That's what we do in sustainability. We find the waste and we develop programs to eliminate that waste. So I want to end again in the same spirit that I began with, which is that the buildings we heal people in should not be the reason they get sick. That's the motto that we go by, why we come to work every day to do this sustainability work in healthcare. I think it's very, very important. It's the driving force of everything that we do, local law 97 or not, incentives from here or there. This is something that everyone in healthcare, I think, truly believes. And that's my presentation. I look forward to meeting everyone, hopefully at the event, and answering your questions right now.
Fantastic. Well, thank you so much, Aharon. No, I think so much of what you said, again, back to, this is why we do what we do. Health and climate are so interconnected. And it's so important to be having these discussions within a huge healthcare system that can have such scalable impact, right? But one of the important things that you really brought up when you were talking about this, because I think this is a challenge across many sustainability professionals, is creating that business case for the decision makers and putting it in terms of efficiencies, managing risk, these compliance, meeting compliance requirements and so forth to really move the needle and get these big major projects, transformative infrastructure projects to pass through. And so there was that
Yeah.
slide that you had on that financial shift. And I think this is coming from, how you stack your incentives. But would love to go back to that for others who are, maybe in healthcare systems in New York or outside of, can you walk us a little bit of how you do that? Like what's your process?
So it all starts first of all with the energy. It all starts actually with the commitment from the organization. Once you have a commitment from the organization that's understood and a plan that's developed based on that commitment that everyone's on board with, that is the starting point, because if you don't educate everyone in your governance structure who you need actually to get these projects done, say, okay, well, why this and not something else, right? Building the business case is first of all dependent on making sure that people know, first of all, what it is that you're talking about. So it's important to have good executive leadership, and I'm happy to say that we certainly have that here at Montefiore. Now, the second step here is that you really must do is to understand your building. A building energy audit, a level 2 or level 3 or investment grade, when you're talking about a big specific project that you want to get past, um, is really very, very strong information that you can use to justify the project in the first place on its technical energy management infrastructure building system side. So understanding, the current system and how it works, what costs the organization is incurring as a result of those, and what the proposed technological solution then is, are the two most important pieces that you'll get out of that audit. And you take that and you start developing feasibility study, let's say for a heat pump project, and then you have all your technical documents and you're coming to propose to pass this. That's where the incentive stacking really comes in. But what I think would work for an organization anywhere, even outside of New York City, are those first two stops, because these projects have, typically they should, and if they don't, you really shouldn't consider them, honestly. Very, very good paybacks and returns on investment, uh, especially after you stack these incentives on top of them, but also outside, but also without those. And so I think that anyone could get large infrastructure projects, as long as you do those, the proper education of your stakeholders and the due diligence of designing a project, with great specificity and with very robust, often sometimes third-party audited finances, and the opportunities for the specific incentives. Here we're talking about New York, but there have been federal incentives. Some of those are rolling back a little bit, but there are, especially when you're talking about resiliency, that the federal government certainly still has some of those in place. If you're in specific states, have incentives. So wherever you are, you should really look to the incentive structure in your state. And globally, I think this is very relevant. Every country has different incentive ecosystems, and certainly other countries also have disincentive ecosystems. You look at the European Union, and other countries have lots of requirements for decarbonization. So when you are presenting the project finally, you want to make sure to include those in your proposal, as long as you're sure you're going to get the incentive, and as long as you're sure you're going to avoid the disincentive, right? Those should be included in your cash flows, and then hopefully you've done the work beforehand to educate your stakeholders, so that when you come with all this information for approval of a project and then building out a project, all of that education that you've done has done its work, because now you're coming to the conversation on equal terms, on the same wavelength.
Right. And so, you actually had your four steps, your four principles of
Sure.
how you begin this transformation, like incorporating sustainability or your sustainability approach, so to speak. For health systems outside of the US, you just mentioned European Union or even Southeast Asia, where, we have very different regulatory contexts. It could be completely different. Of these four principles, what would you say is that those non-negotiable like first steps? Is it those first two where is it all about the data and like kind of figuring this out, or what would you recommend to folks?
Oh, it's a great question. I would say that, all of them are required ultimately, but certainly you can accomplish a lot, I'd say, by using, let's say, number ones of anchoring yourself in strong data, as you said, and number four, as I just mentioned, engaging the front line, but also engaging everyone in your organization. So anchoring in data, again, you can't fund what you're not measuring, and you have to make sure that your numbers are solid. Just like with any investment
Right.
recommendation that you're making to anyone, you've got to make sure that the dollars are right, that the emissions are right, because that will drive, because you can know your building very well, right? You could perform great energy audit, understand the system very well, but if you don't have good data, that's not going to help you. You're not going to have a good proposal. That's because you need to know what the dollars and cents are ultimately that are being driven by whatever building system you're trying to improve, change, right, upgrade. Um, and you can't stack the economics, right? That was number. You can't do that either without good data. Uh, you can have all these incentives in place. You're actually not going to get approval for those incentives if what you're working with and submitting for those incentives is not good data, because this stuff gets audited. We treat it with a very, very high level, investment grade level gloves. So I would say number one, anchoring yourself in data, and number four, engaging the front line. But I would broaden that to the entire organization. Once you have those two things, everything kind of becomes technical.
Absolutely fantastic. No, I thought, actually the clinical sustainability initiatives that you mentioned of, engaging your doctors, those on the front lines, they were able to find those inefficiencies, those waste, projects that you could take on that had quite scalable, impactful numbers. I mean, it was really impressive. So, and I
Yeah.
think one of the things too that I was impressed by, like just looking at your organization too, is that you have a whole decarbonization committee that is across departments.
Yeah, that's right. I'd say that speaks to what I started with going through these steps, is having strong governance. Yeah, we have executive leadership, and and that comes down through Department of Engineering, through facilities, to our Office of Sustainability. But then we report out to a committee that includes environmental health and safety, design and construction, risk, of course, engineering, lots of different departments that need to be aware of the work that we're doing. So at the very least, and usually there's a lot more than that, but at the very least, they are well informed, and are again, like I said, on the same wavelength once you're coming to a proposal. Now, the last thing I should mention in terms of engaging the front line is that if you'll take a look, and I invite everyone to look at our sustainability report online, our 2025 sustainability report, you'll see in our governance structure that it doesn't end with the top-down executive leadership through the committee, but actually we have an integral part of that is grassroots leadership. So that's where the clinical sustainability side really comes in, but really not just clinical, really anything that's outside of the traditional building decarbonization that we're doing is really fueled, no pun intended, by our frontline staff who really, really care about this too. It's not part of their full-time jobs. They're not obligated to do any of this work. Like I mentioned, there's those two phenomenal doctors who just saw a inefficiency in our printing, right? And we print a lot, and they saw, these aren't required from a legal side. Customers are, sorry, patients are usually using the digital versions. Like, let's just do away with that. If they want it, we can still print it. These are ideas that can never be driven by folks who are not in the medical field, like myself and most people in the rest of that governance structure that I discussed. This is why it's critical that you really engage everyone, and we do that through regular newsletters, Earth Day events, sure, but also an open hour session that we do once a month on Fridays, where we really open up the floor to any ideas from anyone in the organization who wants to come and share. And that's really the main vehicle through which we've created all these additional opportunities. And I should also mention Practice Green Health is an amazing, uh, very, very resourceful industry organization that helps organize all the professionals like myself around around different types of sustainability initiatives that include but go beyond, building systems and decarbonization from that lens.
Fascinating. Aharon. No, I think I mean, it really is showing how you can have a comprehensive approach that, engages and embeds sustainability across departments and how you can really build um, from the ground up, as you said, through grassroots initiatives from your actual employees who are on the ground, kind of seeing and working with patients and so forth.
Yeah.
So, no, thank you again. I think this has been really eye-opening. I love the incentive stacking and really thinking about it from an ROI kind of value creation perspective, but also, ensuring that you're also engaging your frontline workers or frontline employees who are doing the work and are also in the day-to-day of it.
Yeah.
But thank you so much. I mean, I think this
My
was,
pleasure. Thank you very much. Yeah, I should. The last thing maybe I should mention is that hospitals are particularly I would say one of the hardest types of buildings to decarbonize, and the cities recognize that they've helped us with different compliance pathways with local law 97 and different incentive structures that are applicable to hospitals. This is because we run 24 hours a day. We're life safety buildings. We have built into our systems redundancy, but that kind of a built-in inefficiency makes all the more opportunity for it makes the opportunity for efficiency that much greater, and so it's a great journey. I appreciate having the opportunity to come here and discuss it.
thank you. Wonderful.